I made a couple of notes earlier on when you were talking. You were talking about the effect of drugs, and it occurred to me to wonder about the effect of recreational drugs. In particular, let's take a simple one. Let's take someone who's smoking weed. Does that have a detrimental effect on the microbiome?
It's not that well, I mean, smoking full stop does. And smoking, changes the lung microbiome, has a really big impact on the lung microbiome, and there's a lung-gut axis, and the gut will influence the toxicity of smoking by changing the immune response to it. And we know that smokers, for example, have very different risks of things like inflammatory bowel disease and diverticulitis and numerous other gut disorders. So there's absolutely a link there, and it definitively changes it. In fact, different brands of cigarettes have their own microbiomes, and you can tell which brand of cigarette you're smoking simply by sequencing out the bugs. But to come to your point,
to be honest, I think there's an easier way of telling.
Yeah. Well, I don't know. At the moment, everything's like white label, so it's quite difficult to tell. But it does, because, and the reason it does is because, again, there's a co-evolutionary basis for it. So fungi, for example, which are big determinant, actually they make up about 1% of the gut microbiome. They produce lots of very bioactive molecules, which are of course used as, psilocybin, for example, is used as a drug of abuse, but it's also used as a recreational drug. And of course, bugs and fungi have completely co-evolved together, so it stands to reason that they've got enzymatic functions for changing how those drugs work and how the side effects and toxicities you feel of those drugs. In opiates, so I use opiates in my job, I'm a surgeon. Microbes are, opiates will change the microbiome, but also the microbiome will influence how effective those drugs are at treating pain, and also their risk of toxicity and side effect, which is why fecal transplant is being used as a treatment for drug addiction. And even the most simple drugs that we take, like paracetamol, the most studied drug of all time, the most used drug, its efficacy and toxicity is modified by the microbiome, because the microbiome has lots of Clostridia in it. Clostridia soaks up sulfur, and your liver needs sulfur to metabolize paracetamol through the glutathione reductase pathway to excrete it. And of course, if it doesn't have enough sulfur, it can't do that, and therefore you're more likely to have toxic side effects. And we can predict that by measuring, the byproducts of these microbial metabolites in urine. So gut bug drug interactions, whether they're recreational or pharmacological, are hugely important, massively misunderstood, and not at all well understood, particularly by clinicians administering drugs. So if you're giving, I talked about polypharmacy earlier on in our conversation, to elderly people who have a less resilient microbiome with less ability to co-metabolize these drugs, their risk of toxicity and side effect is greatly changed by the microbiome. Therefore, nutrition, diet, and promoting gut health becomes a key component of their treatment, not just to make them healthy more broadly, but to help them metabolize their drugs more safely. And actually, treating and preventing polypharmacy is something that we should probably all be doing more generally in our practice.